151. Eye protection is necessary when there is a risk of splashes or sprays of body fluids. True or false? Answer: true. Rationale: goggles or face shields protect mucous membranes of the eyes from infectious fluids. 152. Surgical masks are sufficient for protection against measles. True or false? Answer: false. Rationale: measles requires airborne precautions, including the use of an N95 respirator mask. 153. Patients with open wounds should always be in isolation. True or false? Answer: false. Rationale: not all open wounds require isolation, only those infected or at high risk of infection transmission. 154. The incubation period is the time between exposure to a pathogen and the appearance of symptoms. True or false? Answer: true. Rationale: the incubation period is the asymptomatic phase after infection when the organism multiplies. 155. The use of gloves eliminates the need for hand hygiene. True or false? Answer: false. Rationale: hands should be cleaned before and after glove use to prevent contamination. 156. Sterile technique is required when inserting a urinary catheter. True or false? Answer: true. Rationale: invasive procedures like catheter insertion require sterile technique to prevent infection. 157. Bacteria that are resistant to multiple antibiotics are known as superbugs. True or false? Answer: true. Rationale: superbugs, such as MRSA or VRE, are resistant to several classes of antibiotics, making them difficult to treat. 158. Proper disposal of sharps includes recapping used needles. True or false? Answer: false. Rationale: recapping needles increases the risk of needle stick injuries. Used sharps should be immediately disposed in puncture-resistant containers. 159. Fomites are inanimate objects that can carry infectious agents. True or false? Answer: true. Rationale: fomites like stethoscopes or doorknobs can harbor pathogens and spread infection. 160. Antibiotics are effective against both bacterial and viral infections. True or false? Answer: false. Rationale: antibiotics only treat bacterial infections. They are ineffective against viruses. 161. Hand hygiene is the most effective method for preventing the spread of infections. True or false? Answer: true. Rationale: hand hygiene, especially hand washing with soap and water or using alcohol-based hand rub, is the most effective way to prevent infection transmission. 162. A face shield provides adequate protection for the mucous membranes of the eyes, nose, and mouth during patient care. True or false? Answer: true. Rationale: a face shield covers the entire face, providing protection from splashes and sprays of bodily fluids. 163. It is acceptable to reuse a disposable mask if it has not been soiled. True or false? Answer: false. Rationale: disposable masks are designed for single use only and should be discarded after each patient encounter. 164. Droplet precautions are required for diseases such as influenza and pertussis. True or false? Answer: true. Rationale: droplet precautions are required for diseases transmitted through large respiratory droplets, such as influenza and pertussis. 165. Airborne precautions require patients to be placed in a negative pressure room. True or false? Answer: true. Rationale: airborne precautions require negative pressure rooms to prevent the spread of infectious particles to other areas. 166. A clean object can remain sterile if it is left uncovered in a clean environment. True or false? Answer: false. Rationale: sterile objects must remain covered and protected to prevent contamination from airborne particles or touch. 167. It is safe to wear the same pair of gloves throughout multiple patient interactions as long as there is no visible contamination. True or false? Answer: false. Rationale: gloves should be changed between patient interactions to prevent cross-contamination, even if they appear clean. 168. Hand hygiene should be performed after removing gloves. True or false? Answer: true. Rationale: Hand hygiene should always be performed after glove removal to eliminate any potential contamination from the gloves. 169. Infected patients must always be placed in isolation, even if they do not show symptoms. True or false? Answer: false. Rationale: not all infections require isolation. It depends on the disease and mode of transmission. For asymptomatic patients, isolation may not be necessary. 170. Antiseptics can be used on living tissues to prevent infection. True or false? Answer: true. Rationale: antiseptics are chemical agents applied to living tissues to reduce the risk of infection. 171. Patients with immunocompromised conditions should follow the same infection control practices as the general population. True or false? Answer: false. Rationale: immunocompromised patients require additional precautions to protect them from infections due to their weakened immune system. 172. It is safe to place a sterile object in a sterile field even if it has been touched by a non-sterile object. True or false? Answer: false. Rationale: contact with non-sterile objects contaminates the sterile object, violating sterile technique. 173. The effectiveness of alcohol-based hand sanitizers is reduced when hands are visibly dirty. True or false? Answer: true. Rationale: alcohol-based hand sanitizers are less effective when hands are visibly dirty or contaminated with organic material. 174. The use of personal protective equipment, PPE, is necessary only during high-risk procedures. True or false? Answer: false. Rationale: PPE should be used according to the patient's condition, the task being performed, and the type of exposure risk, not just during high-risk procedures. 175. A gown is required for all patient interactions to prevent the spread of infection. True or false? Answer: false. Rationale: gowns are required only when there is a risk of contamination of clothing with body fluids or secretions. 176. Infected wounds should be covered with a sterile dressing to prevent the spread of infection. True or false? Answer: true. Rationale: a sterile dressing helps contain the wound's secretions and prevents contamination from the environment. 177. Gloves should always be worn when handling contaminated patient items, such as linens. True or false? Answer: true. Rationale: gloves should be worn when handling any potentially contaminated items to prevent transmission of infectious agents. 178. If a healthcare worker has a minor cut on their hand, they should continue to provide patient care without any additional precautions. True or false? Answer: false. Rationale: healthcare workers with open cuts or wounds should use proper protective equipment, such as gloves, to prevent exposure to infectious materials. 179. Transmission-based precautions are implemented only when a patient has been diagnosed with a specific infectious disease. True or false? Answer: true. Rationale: transmission-based precautions are applied based on the known or suspected mode of transmission of a patient's infection. 180. Patients with a positive methicillin-resistant Staphylococcus aureus, MRSA, culture should be placed in contact isolation. True or false? Answer: true. Rationale: MRSA is a highly contagious bacterium resistant to many antibiotics, and contact isolation is required to prevent its spread. 181. Surgical masks are effective in protecting healthcare workers from airborne pathogens. True or false? Answer: false. Rationale: surgical masks are designed to protect against droplet transmission but are not effective for airborne pathogens, which require N95 respirators. 182. The use of personal protective equipment, PPE, includes gloves, gowns, masks, and eye protection. True or false? Answer: true. Rationale: PPE is composed of gloves, gowns, masks, and eye protection, and is used to minimize exposure to infectious agents. 183. If a patient is known to be infected with a multi-drug resistant organism, strict isolation is required regardless of symptoms. True or false? Answer: true. Rationale: multi-drug resistant organisms require strict isolation to prevent the spread of resistant infections. 184. Antibiotics are effective in treating viral infections such as the common cold and influenza. True or false? Answer: false. Rationale: antibiotics are only effective against bacterial infections and do not treat viral infections. 185. Hand hygiene should be performed for at least 20 seconds when washing hands with soap and water. True or false? Answer: true. Rationale: hand hygiene with soap and water should last for at least 20 seconds to effectively remove germs. 186. Respirators, such as N95 masks, should be used when treating patients with tuberculosis. True or false? Answer: true. Rationale: tuberculosis is transmitted via airborne droplets, and N95 respirators provide the necessary protection. 187. Airborne precautions are necessary for diseases such as measles and chickenpox. True or false? Answer: true. Rationale: measles and chickenpox are transmitted through airborne particles, so airborne precautions are needed. 188. It is acceptable to wear a mask for the entire duration of a shift without changing it. True or false? Answer: false. Rationale: masks should be changed when they become moist, soiled, or after patient care to maintain their effectiveness. 189. If a healthcare worker has been exposed to blood or bodily fluids, they should immediately wash the exposed area and report the incident. True or false? Answer: true. Rationale: immediate washing of the exposed area and reporting the incident helps prevent potential infection and ensures proper follow-up care. 190. It is safe to reuse disposable gloves if the healthcare worker is handling the same patient. True or false? Answer: false. Rationale: disposable gloves should be discarded after each patient contact to prevent cross-contamination. 191. When providing care for a patient with a respiratory infection, it is important to ensure the patient is in a private room. True or false? Answer: true. Rationale: a private room helps prevent the spread of respiratory infections to other patients. 192. Wearing gloves can eliminate the need for hand hygiene. True or false? Answer: false. Rationale: hand hygiene should always be performed before and after glove use to ensure that hands remain free from contamination. 193. Standard precautions should be followed with every patient, regardless of their infection status. True or false? Answer: true. Rationale: standard precautions are used for all patients to reduce the risk of infection transmission. 194. It is acceptable to wear the same gown for multiple patient interactions if it has not been soiled. True or false? Answer: false. Rationale: gowns should be changed after each patient contact to prevent cross-contamination. 195. The primary goal of infection control practices is to eliminate all pathogens. True or false? Answer: false. Rationale: the goal is to reduce the transmission of pathogens, not necessarily to eliminate all pathogens, as some may persist in the environment. 196. To prevent contamination, sterile equipment should only be opened right before use. True or false? Answer: true. Rationale: sterile equipment should only be exposed to air and handling immediately before use to prevent contamination. 197. A patient with a known viral infection, such as HIV, requires contact precautions only. True or false? Answer: false. Rationale: the level of isolation depends on the specific infection and the risk of transmission, so the correct type of isolation should be used. 198. Hand hygiene can be performed using alcohol-based hand rubs if there is no visible dirt or organic material on the hands. True or false? Answer: true. Rationale: alcohol-based hand rubs are effective when hands are not visibly soiled, and they can quickly eliminate most pathogens. 199. Infection control protocols for high-risk patients, such as those undergoing surgery, should be more stringent than for low-risk patients. True or false? Answer: true. Rationale: high-risk patients are more susceptible to infections, so enhanced infection control measures are necessary to protect them. 200. Only healthcare workers who are directly involved in patient care need to follow infection control procedures. True or false? Answer: false. Rationale: infection control procedures should be followed by all healthcare workers, including those in administrative and support roles, to prevent the spread of infections.